So this is the Airway Metric system that we'll be using to register Kim's bite registration. This has a vertical component as well as a horizontal component. We're going to start first with what's called the snore screener. And this is to determine if there's a vertical component. And this is 4 millimeters, the next step is 8 millimeters, and the next step is 12 millimeters of vertical height. So this is where the fun begins, and we do have a lot of fun doing this. We're going to ask Kim to give us her best snore. And we obviously know that she snores because that was part of her intake information that we did with her when we reviewed her health history. So Kim, let's hear it. Give us your best snore. What do you think, Tammy?
I think she can do better.
Come on, Kim. Give it all you got. Awesome. So we're going to go to our first vertical level, which would be 4 millimeters. That's this first step. We'll place this in between her maxillary close and anterior teeth and make sure you hold it and give us your best snore, Kim. All right, Tammy, what do you think?
Still too loud.
Still too loud, I agree. Let's see what 8 millimeters does. So we're going to go to our next step, which would be 8 millimeters of vertical. Close. Now try that. Better, right? We're still hearing a little bit of noise. And open. I don't like to go to 12. 12 millimeters is a lot of vertical. Remember, we want to encourage nasal breathing. If you look at the literature, there is documentation that mouth breathers have a more severe AHI than those that are nasal breathers. So this is where the fun begins. Tammy, let's try our nose cones, and this is just an option for assisting and treating the patient, and see if we notice a difference with her snoring. So we're going to go back to the 4 millimeter step and see what happens. And close. Now try it, Kim.
Big difference.
Hopefully you all heard that. Try it once more. She can barely get any amount of snore in there. And open. Let's go back to the Airway Metric system. Each one of the keys is set up appropriately at either 4 millimeters of vertical, 6 millimeters of vertical, 8 millimeters of vertical, 10 millimeters of vertical, or 12 millimeters of vertical. Then if you go horizontally, it goes from 2 millimeters of horizontal movement or protrusive all the way up to 7 millimeters of horizontal movement or protrusive. So we saw that Kim responded very well at 4 millimeters. Remember that the minimum thickness that you need for an oral appliance is 4 millimeters. That's why there's a 4 millimeter key. Let's start at 6 and see what happens with Kim. And I always start 6 edge to edge because less is more. I can always move my appliance forward. You can't move the appliance backwards. They all have some type of an advancement mechanism, and we'll look at that shortly. So here is 6 millimeters vertical, and this is edge to edge, edge to edge. This would be 4 millimeters of protrusive or horizontal and 6 millimeters. So remember, I always like to start with less is more, meaning edge to edge. So let's see how Kim responds at 6 millimeters of vertical in an edge to edge position. We will position this notch over her maxillary incisors and have her close into the single notch with her mandibular incisors and see what type of response we get. So Kim still has our nose cones in. Let's position our key, middle notch, close into that notch, Kim? Now, for video purposes, I'm going to let go of the key. I advise you not to do that. Keep control of the key, because we're going to have her snore and inspire, and the last thing you want to do is have your patient aspirate that key. So I'm going to go back and hold it. Go ahead and try it now, Kim. Once more. Good. And open. Kim, how'd that feel on your jaw joint?
Good.
No pain?
None.
All right. Let's see what 2 millimeters of horizontal movement does for us. This is our 6 millimeter vertical key, and you'll see the number 2 and the number 3 here. We're going to try 2 millimeters of horizontal advancement at 6 millimeters vertical. So this notch goes on her maxillary anterior teeth, and she will move her mandible into this lower notch, and that will be 6 vertical, 2 horizontal, and let's see how she responds. So we'll put the 2 notch over her maxillary anteriors, move into the lower notch. Good, right there. I'll take my fingers away just for the video so you can see how it's positioned. I'm going to hold it. Give us your best snore, Kim. All I'm hearing is air. That's what an awesome sound. And open. Just for demonstration purposes, let's try 3 millimeters of horizontal. So in order to do that, you need to turn the key, and the 3 faces the throat. So to go 3 millimeters horizontal, we turn the key, and the 3 faces the throat. Go ahead and close. Try that now, Kim. So we don't hear a lot of difference between the edge to edge, the 2 or the 3. And open. I would set the appliance and take the bite registration at 6 vertical, edge to edge, because I can always advance the appliance forward. So Tammy, let's go ahead and get prepared to do our bite registration. And what we're going to do is switch back to the 6 millimeter vertical. Notice it goes 4, edge to edge, and 6. So we're going to use the edge to edge. It doesn't matter what number faces the throat in this position, because edge to edge is edge to edge. We'll take the bite fork, position it on our key, and we will take the handle and put it on the other end of the key. Now in this situation, it doesn't matter what number faces her throat, because we're using the edge to edge position. If there was more of a horizontal component, it would be critical for you to pay attention how you position the handle and the bite fork on the key to ensure that you're in the proper position. So once again, we're going to use our polyvinyl putty. Go ahead and mix, Tammy. 3-minute set. And Tammy will load a little bit extra on that lower left side, because Kim is edentulous there. As I always like to say, when Tammy mixes the putty and puts it on the bite fork, it's kind of like going to the state fair and getting a corn dog. Yeah, you're allowed to laugh, Kim. Right, Tam?
You
So that's why I call it corn dogs. Corn dogs on a stick. Great. So we'll position the middle notch and open over her maxillary anterior teeth. Move close forward, back a little bit. Good. Kim, just put your tongue to the roof of your mouth. Good. And then I will once again take my fingers and press the putty from the back buccal vestibule into bite fork. And we'll wait for our timer to set. And I always like to hold the patient's chin just to remind them not to open. So our timer's gone off. We'll verify the putty is set and go ahead and open, Kim. We'll remove our Airway Metric's bite. The handle comes off. That stays behind. The key stays off and stays behind. And once again, those are not autoclavable. And you can see we have our nice bite registration. And I will trim this now and then reseat it to verify that the bite is comfortable for her and to verify the midlines. I'm going to use a 25 Bard Parker blade. And we're going to trim our bite registration just to have our cusp tips, just like you would trim a crown and bridge bite registration. So we've trimmed our bite registration, and we're going to go back to the mouth, seat it, verify that the midlines line up and that Kim is comfortable with this in place. All right, so we'll seat our index and close together now, Kim, into that. All right, so we can verify that our midlines are aligned. I like this system because it's easy to see that we have maintained our midlines. Kim, how's that feel? Comfortable, not stressing your jaw joints at all?
No.
Okay, good. And open. So this will go to the lab with our models and the prescription for our oral appliance.